fentanyl produces a variety of responses within the body. It kind of depends on each person, whether they've used the substance before, or maybe they have a tolerance, maybe they don't. Also kind of how their body will metabolize the drug. So side effects can be different for everyone, but common side effects are, nausea, vomiting, sleepiness, drowsiness, even sometimes dizziness, and even sometimes like that the lower resting heart rate, the lower respiratory rates. So it can affect our normal bodily functions of breathing and our heart pumping. So that's really why it's so important that when we administer fentanyl, especially under medical care, that we're really monitoring those things, because that can be really dangerous for some people. Fentanyl typically affects the brain in the pain receptor centers and the emotional centers. So sometimes you'll also notice that people who use fentanyl are kind of flat. They may not have a lot of emotion, and that's just because of that area within the brain that fentanyl interacts to cause that pain tolerance decrease. So fentanyl overdose is actually really an easy thing to do, just because it is more potent than something like morphine. So that's why when it's given in a controlled environment like a hospital or a clinic where you have doctors who are monitoring that, we don't see overdose a lot. But when people are taking these outside of those controlled circumstances, it is easy to overdose because it does take such a small amount to create the effect. So fentanyl overdoses are commonly treated with a drug called naloxone, and that comes usually as an injectable, kind of like an EpiPen, or a nasal spray. So sometimes you'll find that obviously first responders carry that, but sometimes other people will have that as well, especially if maybe they're prescribed things like fentanyl derivatives for pain control or for some kind of medical condition. But because fentanyl is so potent, sometimes it takes a lot of those drugs to reverse the effect. So essentially what happens when you overdose is there's so much saturation of the drug within your brain, and that naloxone is just going right to the point in the brain where that saturation is, and it's basically removing that fentanyl and binding to the brain receptors instead. But unfortunately, when people overdose, there's usually such an abundance of the drug that sometimes it can take quite a lot of the medication to reverse the effects. So it's really important that obviously people, if they think that someone is overdosing or has overdosed on fentanyl, that they call 911 and get help immediately. So anyone who thinks that they may have come in contact with fentanyl and that it may be on your skin, it can be absorbed transdermally, meaning that it can be absorbed through the skin. So it doesn't require ingestion in order to cause an effect. So it's really important that if you think that you possibly were exposed to fentanyl or have fentanyl in your skin or your hands, that you try to obviously get medical attention, but also try to wash that off, but do not wash it with any kind of alcohol-based sanitizers or soap. So make sure that if you're trying to wash your hands after you think you may have been exposed, you make sure that those ingredients are not found there. Alcohol can basically increase the absorption through the skin, so it's more dangerous. So if that's your only option, you'd basically be better off just waiting for medical attention to help you.